Hi, I'm Jenny Ha. I'm a sociologist and scientist in the Center for Innovation at Canadian Blood Services and adjunct faculty in the Department of Health Sciences at Carleton University. I'm presenting from the unceded traditional territories of the Algonquin and Anishinaabe Nation, also known as Ottawa, Ontario, Canada. I extend my respect to all First Nations, Inuit, and Métis peoples for their valuable past and present contributions to this land. I want to thank the organizers for the invitation to present some of my work on cord blood donation during the Donor Research Network Week of Talks. The title of my talk is I'm Part of a Larger Community Helping Each Other Out, a qualitative analysis of meanings of cord blood donation. This is based on a research study that was funded by the Canadian Institutes of Health System Impact Fellowship. Here's a very high-level outline of my presentation. I'll provide a bit of background on umbilical cord blood donation and the National Public Cord Blood Bank in Canada. I'll follow this with an overview of the social science literature on cord blood banking, including a broad review of the literature on why women donate or would donate cord blood and some gaps in this literature. Next, I'll present my study and the results of a qualitative analysis of the meanings of cord blood donation for women who donated or wanted to donate. And I'll end with a few concluding thoughts and implications. So cord blood is the blood remaining in the umbilical cord and placenta after a woman gives birth. If the umbilical cord is clamped immediately or soon after giving birth, the remaining blood can be collected, processed, and frozen for future clinical use. The blood is rich in blood stem cells, and since 1989, when it was first used successfully to treat a young boy with Fanconi's anemia, it's now used to treat over 80 diseases and disorders, including leukemia, lymphoma, sickle cell anemia, as well as other inherited immune system and metabolic disorders. Cord blood is interesting from a sociological perspective for a number of reasons, of which I'll highlight a few. With these new clinical uses for cord blood, viewed from a Western biomedical paradigm, cord blood is considered to have been transformed from waste to gold, raising questions about new forms of values, uses, and exchanges for this biological material. The potential for clinical uses of cord blood have led to the growth of a commercial for-profit industry of private cord blood banks that will store cord blood for the child or family's future use for a fee. In Canada, private banks have been around since the late 1990s and early 2000s, and actually predate the opening of the National Public Cord Blood Bank. So in some countries such as Canada, for some women, they have an additional option to donate cord blood to a National Public Cord Blood Bank. The cord blood bank here would be made available to anyone who needs it, and this form of cord blood donation does not require that women pay to contribute. While I've highlighted these two relatively newer options for women regarding cord blood, it's important to note that other options regarding cord blood also include delaying cord clamping to maximize the infusion of cord blood into the newborn after birth. And there's some ongoing debate about the health benefits to the newborn based on the length of delayed clamping. And secondly, for some women, cord blood has long held symbolic significance and or health benefits for the mother. So there are ways in which cord blood has been valued prior to the discovery of its clinical uses. Combined, what this suggests and what is of interest to me as a sociologist is that what to do with cord blood has become an increasingly important and potentially contested site of personal, social, and ethical decision-making. And just to highlight in this talk, I'm focusing on the option to donate cord blood to the National Public Cord Blood Bank, so this last option that I discussed. Beginning in 2013, in Canada, with full implementation completed in 2015, women who give birth in 4 cord blood collection site hospitals have the option to donate cord blood. And here on this slide is a map of Canada, and the 4 blood drop symbols that you see on this map indicate the cities in which these hospitals are located. So moving west to east, they're in Vancouver, Edmonton, Brampton, and Ottawa. And there were a number of considerations given to selecting these cities in Canada, including selecting hospitals that provide care for an ethnically diverse population of pregnant women to better meet the needs of Canada's ethnically diverse population. Currently, the National Public Cord Blood Bank is part of Canadian Blood Services One Match Stem Cell and Marrow Network. So Canadian Blood Services is responsible for recruiting pregnant women to donate cord blood to the public bank. Data from the National Public Cord Blood Bank is uploaded to an international database of more than 600,000 cord blood donations from 47 cord blood banks around the world. So what this means is for women who have a bankable cord blood unit and donate to the National Bank, their cord blood could be used for a Canadian patient if there's a match, or if there's a match in a patient overseas in a different country, their cord blood could potentially be used for someone overseas. Here's a broad overview of some of the main areas of social science research on cord blood banking. Compared to other forms of donation, such as blood, it's not large, but there are some notable streams within this literature. And this is just one way. I've organized it one way, but there are, of course, many ways you can organize this literature. One stream examines the political economy of cord blood banking and the production of new forms of value. This includes new forms of bio-values, profit and promissory values, their social and economic significance, and the interplay of commercial and nonprofit circuits of use and exchange. A second stream in this literature I've categorized as the ethical, legal, and social debates regarding cord blood. These include debates over private for-profit banking versus public donation. And notably in Canada, maybe not surprisingly, these debates were most prevalent prior to the opening of the National Public Bank, when people were advocating for the need of a national public bank. There's also legal debate over property rights in the body and legal and social understandings of ownership of one's own biological materials. Third, social science research has also examined cord blood collection practices from the perspectives of the various social actors involved, including prenatal and maternity care staff and frontline staff, looking at things like conflicts and compromises among social actors, the work and labor involved in cord blood collection. And lastly, I've grouped together empirical research that examines cord blood banking and donation from women's perspectives. This includes their knowledge of views on why they would donate or bank privately, and their experiences of cord blood banking and donation. It's notable that women's experiences of cord blood banking and donation is quite limited, and most of the research, with the exception of Mashin and colleagues, are quantitative surveys of pregnant and expectant women. So not necessarily specific to the population of women who have actually donated to a public cord blood bank. In the next slide, I'll outline a bit more about what we know about why women donate cord blood or would donate cord blood. So the existing literature demonstrates that most pregnant women would donate cord blood to a public bank out of a desire to help people, or what's often referred to as altruistic reasons. And generally, the research shows that women who pay to bank in a private bank do so out of a concern that their child might need cord blood in the future. So for women who bank in a private bank and save it for their child, they do that out of a desire to have it available for their child if needed. So often, the reasons why women donate cord blood and the reasons why women bank privately for a fee is often framed as women donate cord blood to help others, or they bank cord blood in a private bank for their child. So often it's framed as an either or kind of framing of it. So you either want to help your child or help others. One exception is a study by Mashin and colleagues. They conducted qualitative interviews with a range of social actors involved in cord blood donation, including women who were cord blood donors. And they found that some donors felt that if they donated to the public bank, their donated cord blood may be available for their child if needed, suggesting that they viewed their donation to the public bank as something that could also potentially help their child. So it kind of is a different framing than an either or kind of framing. Overall, though, the limited research on this topic suggests that women donate or would donate cord blood for altruistic reasons. And this is certainly how many public banks frame their recruitment strategies to women. If we look at literature beyond cord blood donation to other forms of donation, such as blood and gametes, we find research that demonstrates the limits of altruism in explaining as an explanatory factor for donation. For example, Smith and colleagues in their study of blood donors in Canada argue that altruism has limited explanatory power. And they explain this by saying, while donors might draw on the discourse of altruism to explain why they donate, it's not the case that people who don't donate are not altruistic. So in other words, a lack of altruism doesn't explain why people don't donate. So it has some limited explanatory powers if we're trying to understand the phenomenon of donation broadly. In addition, research on blood donation shows that donors do not necessarily view their donation as a one-way gift, but as a way to contribute to a blood system that they may need to receive from in the future. And Busby refers to this as mutuality. Research also shows that different types of biological donation hold different meanings for the people who donate, which can influence and shape the reasons for donation. So together, this suggests a need for further research on the meanings of cord blood donation for donors and greater exploration of what helping others or altruism means in the context of public cord blood donation. So this brings me to my study. From 2017 to 2019, in collaboration with Canadian Blood Services Cord Blood Bank, I conducted a qualitative process evaluation of in-hospital recruitment and cord blood collection. We wanted to understand the process of recruitment and donation from the perspectives of all the various social actors involved, including women, donors, and frontline staff. And the reason for this is because oftentimes what actually happens on the ground in practice differs from what the process is supposed to be in theory. So the aim was to optimize recruitment and cord blood collection by identifying barriers and enablers in the process. So in the first phase, I interviewed staff and managers and conducted on-site visits. In the second phase, I conducted semi-structured interviews with 76 donors and potential donors to understand donation for their perspectives. Here I include donors and potential donors because not all women who wanted to donate were actually able to donate given the organizational constraints of donation. So for example, if a woman wanted to donate and had actually registered to donate, but gave birth on the weekend, she wasn't able to donate. So she would be considered a potential donor since she wasn't actually able to donate. And so that, based on, in the first phase of analysis, I produced a report identifying some barriers and enablers. And this presentation today is based on secondary analysis of the qualitative donor interviews. I went back to the donor interviews to explore the meanings of donation for the women who donated cord blood. The analytic approach taken is informed by inductive thematic analysis and grounded theory, where models and theory are developed beginning from the data, focusing on a holistic analytic approach to examine meanings of donation. And here I have a quote from Dayer and colleagues who write in relation to qualitative analysis of meanings. They write, doing does not refer to behavior, but rather to culturally located, goal-oriented actions. So the question that guided the analysis for this presentation was, what are the meanings and understandings of donation for women who donated or wanted to donate cord blood? And here's a table that summarizes the research participants in phase 2. Participants were recruited through the cord blood donor database and through online prenatal and new mom groups. The vast majority of respondents were from the donor database. We had very low response rate from recruitment through online groups. Of the 76 donors or potential donors, most were between the ages of 30 to 39. Most identified as Caucasian or white, with 33 identifying as a racialized ethno-cultural identity. It's worth pointing out that the ethnicity breakdown in the public cord blood bank is approximately 60% identifying in a racialized ethnocultural group, and 40% is Caucasian white. And this speaks to their efforts to really recruit and promote cord blood donation amongst racialized communities. Most participants reported occupations at the upper end of the International Standard Classification of Occupations, suggesting higher socioeconomic status of the sample population. And this last category here, relatively equitable distribution across the 4 collection site hospitals. And you'll notice there were 3 that were in cities that don't have collection site hospitals, 2 in Toronto, 1 in Barrie. And these were women who were recruited through the online groups, and they had wanted to donate, but then learned that they weren't able to. Turning now to the results. Here's a visual overview of the meanings of cord blood donation that emerged in the data. And this is an early attempt to develop a thematic model for the meanings of cord blood donation. The red concentric circles, women, child, family, and community, represent the locus or relation within which the meanings are situated. So for women in this study, in relation to themselves, donating cord blood was about being responsible stewards, enacting reciprocity, and some spoke of personal empowerment. In relation to their child and or family, donating cord blood meant caring for their child and facilitating their child's first contribution to community. Lastly, in relation to their community, donating cord blood meant they were enacting the kind of community they desired. It was about supporting a collective system, and lastly, contributing to science and medicine. So the concentric circles are meant to reflect the interrelatedness of the multiple meanings of cord blood donation. And that's why I embedded women within child and family, within community. And I'll turn now to discussing each of these themes in greater detail. For some women, donating cord blood meant that they were being responsible stewards and avoiding waste. So not only did donating cord blood mean they weren't wasting something valuable, but also provided an opportunity to recycle, and here I have the symbol of recycling, or in some cases that there's also this idea of upcycling, making something even more valuable, life-saving with the cord blood that had, served their child in utero and could now be used for life-saving material for someone else. And as one participant here said, because I want to help, and I just thought the whole idea that they throw it out, and I don't want to cryogenically freeze it, by which she means paying privately. Like I said, I don't think I need it. It just seems wasteful not to. The second theme, donating cord blood, was also a way for some women to enact reciprocity or to give back for what they had received. For example, P12 here in this quote says, just like my small way of giving back, because I had just been taken such great care of during the whole pregnancy. So viewing her description of giving back as an act of reciprocity kind of challenges or pushes up against Titmus's view of blood donation as a pure gift in which the donor gives without any expectation of receiving from the recipient. Here, the reciprocal relations are between the donor person and healthcare system from which she has received, as she described it, great care. This suggests a model of gift relations and donation that reflects a bidirectional and relational model of donation and challenges a one-way model of altruism. Third, several participants also spoke about cord blood donation as an act of personal empowerment based on rights to make a decision about their own body. And this came up when I asked women to tell me about the role their husbands played in deciding to donate. And most said that it was their decision to make and that their partner had limited involvement. One woman said that her husband wanted her to feel empowered. So she made the decision on her own. And in a few interviews, there were some references that suggested reproductive rights type discourse, this idea of my body, my choice. And in the quote here that I have, P12 says, he, her husband, didn't really have a say in it. It was kind of my body kind of thing. If we were considering keeping it versus donating it, we would have had a longer discussion. But since the plan was for it to be discarded anyway, it was just kind of like my choice. So what's interesting, what comes out in this quote as well, is that private banking was viewed as a decision about their child's future health, and therefore framed within a responsibility for both parents and a decision that both parents would make together. Whereas donating cord blood, as P12 suggests, was viewed as a decision that she was making about her body. And this suggests as well that women view cord blood as part of their bodies and they have a right to determine what they do with it. Turning to meanings in relation to their child and family, in their exploration of why they donated cord blood, many participants suggested that donating to the public cord blood bank was also a way for them to care for their child. So here, P55 says, so if I want her, referring to her daughter, to have access to the cord blood bank in the future if she needs it, then I want to be someone who's like depositing into that bank long before she would potentially need it. So that like models the behavior that I want other people to be doing. The suggestion here is that the more women, the more women donate to the public bank, the greater the chance that her child will find a match in the public bank if she needs it. Therefore, this participant wants to model the behavior of donating to ensure that other women are also donating in the case her child should need it in the future. A few participants also said that by donating to the public bank, even if it's available to anyone who needs it, if their child were to need it and their cord blood bank hadn't been released already, then their child could potentially use it. And a few participants also suggested that donating to the public bank meant that their child would be deserving of taking from the public bank if they needed it someday. So I suggest that this theme here is consistent with Masham and colleagues' study that I referenced earlier that showed that some donors felt that donating cord blood to the public bank could also potentially, in the longer term future, also help their child. So it was donating was about thinking and about it helping others, and also thinking and about the future needs of their child. A second theme in relation to their child and family was donating to facilitate their child's first contribution to the community. And here P1 says, thinking about it and being able to share with my son later on that that's what we did as a family is important for him to know as he goes out into the community how he wants to change where, his society and where he wants to add value. I want him to know that from a very young age, he did share that. So donation for her is what her family did together, and also an act that initiated her son into the act of contributing to and having an impact in his community. So moving now to the largest concentric circle in relation to community, many women spoke about donating cord blood as a way to enact or create the kind of community they wanted to create for themselves and for their child. Again, P1 here says maybe once you're getting to the end of your pregnancy, it's not just about you and your little silo. It's really about what kind of community do you want to raise your child in. And we wanted to raise our child in a place that, was better and more inclusive. For other women, donating cord blood was about community building. And the desire for a particular kind of community wasn't only based on an ideal that they held as individuals, but also as mothers, thinking about what they wanted to provide and create for their child. The second theme here, women also understood their donation as supporting and consistent with a collective system in Canada, and more specifically for some women, the healthcare system in Canada. So here, as P65 says, we live in a society and we have to sort of take care of each other. That's kind of the way our healthcare system is set up, right? That we all contribute to ensure that we're taking care of everyone's health. So this theme differs from the enacting community theme above because of its specific reference to the broader system and the Canadian context and the healthcare system we have here in Canada. For several women, donating cord blood meant supporting Canadian ideals through the support of a public health resource, the National Public Cord Blood Bank, which is consistent with a publicly funded healthcare system. Lastly, in relation to community, donating cord blood was a way to contribute to scientific research and for a few participants, provided an opportunity to be part of a medical team that saves lives. So this is presented in the quote above, where she says, "We are not on the medical team. We don't have knowledge to be in there to help the kids in the medical area. The only thing I can do is just donate whatever I can afford to do to save lives. That's why." And then team, what I mean is it's the team that are trying to save a life. For this participant, and as she continued in this discussion, she made clear that what she meant by it's the team that is trying to save a life, by her donating, she was able to become part of that team, to contribute to the team, and to be part of that team. And so this suggests a community view in which she doesn't view her donation in kind of a stripped down way of just the biological material itself, but situates her donation within the context and relations of a medical team that's required to save a life. So lastly, just a few concluding thoughts. First, our analysis demonstrates that cord blood donation holds multiple meanings for women who donate or want to donate. It shows that cord blood donation is a deeply relational act and offers possibilities for new social relations between women, their newborn and family, and the broader community. As the last example demonstrates, for some women, donating cord blood was a way for them to be part of the medical team, suggesting new social relations between women donors and medical professionals. Second, women's understandings and meanings of cord blood donation suggest that they view it as a shared act with their child, which speaks to the shared or entangled materiality of cord blood. It flows between mother and child during pregnancy. The placenta and cord blood reside in the woman's body until after giving birth. And this demonstrates how medical and legal distinctions of who the cord blood belongs to differs from social and experiential understandings of biological belongingness and ownership. And this extends then to raising the question of, so who is the cord blood donor? Third, meanings of cord blood donation suggest a model of mutualism. That is, many women understood their cord blood donation as helping or benefiting both their child and others, rather than solely a simple model of one-way altruism or an either-or framing of donation versus private banking. Our data and our analysis supports the work of Busby and others with regard to other forms of donation and suggests that women donate cord blood in addition to things like blood donation to benefit both their child and family potentially, as well as others. We suggest this needs that this opens up further research the need for further research on mutual or communitarian benefits of donation and a social relational model of donation. Lastly, the social location and positions of women who donated cord blood is also worth noting. Participants were generally higher on the scale of occupations. They were the other factors that kind of contributed to their social location was that they were all coupled, were in good health, their children were in good health, demonstrating that they had some privilege. It's also important to consider how participants' views on contributing to their community and a sense of mutuality, both in terms of giving to and benefiting from community and healthcare systems, is also shaped by one's social location and full social inclusion. So the questions that arise from this is how might women who are differently positioned or have less access to resources understand and experience cord blood donation, and if it's an activity that would hold meaning for them in a similar way. To end, here are a few implications or suggestions for public cord blood banks and their efforts to recruit women based on the results and analysis. Cord blood, first, cord blood donation is often framed by public banks as a child's donation. But given its relational nature and that women experience themselves as the donor as well, it may be worth acknowledging that donating cord blood is a shared act between mother and child, and that both are donors. And here I suggest it might be worth thinking about how to describe this. I just have one suggestion of co-donors, but there are probably better ways to think about that and capture that. Secondly, it might be effective to highlight the mutual benefits to their child and others and having a strong public cord blood bank available for everyone. So rather than emphasizing cord blood donation as a way to help others, and really emphasizing that kind of one-way altruistic act, it might be effective to also highlight the mutual benefits of a strong public cord blood bank for everyone, including their child and family. And lastly, related to the second point, an emphasis on the contribution to community and the support of a collective healthcare system may encourage women to donate cord blood. And here I recognize that this is context specific to Canada, given our publicly funded healthcare system, but this may also be applicable in other countries with similar publicly funded healthcare systems. Finally, I'd like to thank and acknowledge the invaluable contributions of the women who participated in the research, Dr. Almozen and the cord blood team at Canadian Blood Services, Dr. Polzer and Dr. Devine, who were my supervisors on this project, and in 2017 to 2019, and of course the IHR for funding this project. Thank you again to the organizers and those of you who have watched this presentation.